Jim started experiencing symptoms of schizophrenia in high school. His dad had a heart attack, and Jim believed that he was able to help cure him and bring him, basically like get him healthy again because he was praying, and so he thought that he had a divine power. So he thought that he was able to control other people's behaviors and their emotions. So that was another delusion he had. And he believed he could control people with his breath. So he used like a life force in his breath to get people to do things. He also thought he could control characters on TV. Then he got treatment and went to a doctor. He had tried Thorazine, and then he switched to a different medication later on, and he heard a lot of voices, and he thought people were always talking about him, and he was really paranoid. But in the end, he got some good treatment. He met with a really good doctor, and they figured out a good system.
Hi Jay, how are you doing today?
I don't know. There's a lot going on in my family, and so my dad had a heart attack, but I prayed a lot about it, and I think that I saved him because now he's okay after I was praying.
Okay, was there anything like certain you prayed for? Why do you think you could,
Well, because I heard people tell me that I was doing that, like God's angels were talking to me, and so I think that I saved him.
Oh, okay, so it sounds like you've been having some hallucinations. Hallucinations are just a sight or a sound that you've been hearing, or any other perception that is like experienced by some external stimuli. So I hope you understand what I mean by that. So like when you're saying that God's angels are whispering to you, you're hearing those things. So therefore, it's making you believe that that's who's speaking to you. Has anything else been going on? Do you think why else? Is there any other reasons why you think?
Well, now that you're saying this, I was watching TV, and I kind of thought that people on the TV were doing what I told them, and it happened with my breath.
Okay.
And I think that I have this power now that God's angels talk to me. I think I have this power, and I can control what people do.
No, yeah, that's definitely a power. I get what you're saying, but it does sound like you're having some delusions, which are just some strange false beliefs that you may have prior to the contrary, that may not happen to you or happen in real life. However, it does sound like you've been having some bizarre delusions, just something that normally wouldn't happen. So I hope that helps you understand what else has been going on. Have you had any other things going on, not being able to get your life together, not being able to perform regular tasks in the morning?
I just sit in my room.
Disorganized.
Just sit in my room.
Gotcha. Yeah.
I don't really do much, but my parents get mad at me because I don't really do anything. But yeah, I tried. One of my friends told me that it might help if I smoked. So I tried that. I tried some weed.
Tried some marijuana.
Yeah.
Well, honestly, with use of marijuana in clients with schizophrenia, honestly would not be recommended due to the high risks of psychosis in the person, and especially with the high THC rates that have been in cannabis today. It has been seen to increase psychosis and can have some issues and bring upon your hallucinations or delusions that you're talking about. So it's also not regulated 100% by the FDA for medical use. So maybe look into doing that or trying to cut down to try to reduce some of those psychosis levels.
Okay, so Jim's first medication that he was on was prescribed by his first therapist after he went into asylum. So it is going to be Thorazine, and it is a first-generation antipsychotic drug. And this is going to balance the brain, and it targets the neurotransmitters dopamine. Also, it helps with schizophrenia patients. Now, the side effects of schizophrenia clients they'll experience tiredness and sometimes have tremors here and there. But the biggest thing they should watch out for would be the possibility of TD, which is on a first-generation antipsychotic. And and it's something like codeine or Artane will help reduce this possibility.
So Jim, I know you've been having some issues with going on and off your medication. Is there any reason as to why that is?
I don't like how it makes me feel. Like, it just makes me feel really tired and weird, and so I stopped taking it.
I gotcha. Yeah, just the side effects are sometimes just unpleasant, and it may like lead you to believe that the medication is. Do you ever feel that the medication is worthless or not helping you?
Yeah, I mean, if it makes me feel so bad, I don't want to take it.
Gotcha. So like when you do receive the medicine, do you feel a lot better? Like, do you feel stabilized, or do you just?
I mean, some of like the voices like aren't there as much.
Gotcha. Well, I think that you should definitely be like keeping on your medication, and maybe switching your medication like would be a better option for you. Hi, Consuela.
Hello.
I'm Dr. Siegler.
Hi, nice
Thank
to
you for
meet you.
joining us today. So it sounds here that I've been speaking with Jim that there's been some extreme stress that's been put on the family, and I just kind of want to talk to you about like what's been going on.
Yeah, so he doesn't like his medication, so me and his father have to always monitor him make sure he is taking his medications, and it's getting to a point where we feel that he should be able to take his medication on his own.
Right.
When he doesn't take his medication, then we have to send him to ER, which he has gone a lot in the past couple of months because of this medication, and then that costs us more money to send him to the ER. He also isn't leaving his room ever.
Right.
And we're very family oriented and we want to spend family time together, but he's always in his room. He's never interested in anything that we have to do as a family, and we're slowly giving up and we don't know what to do.
Right, yeah. It sounds like Jim's been dealing with a little bit of like avolition and not wanting to being able to deal with his responsibilities and normal tasks of his daily life. And I'm sure it is very tiresome having to deal with your grown son not taking his medications every day. And yes, medications are very costly, especially with all the hospital trips that you are bringing up and everything. And I'm also sure it's very devastating to see that your child is not able to succeed as well as you would like him to. I'm sure that home is like always very tense because of this, and I just hope sometimes you're not always too harsh on Jim, because this is a disorder that he does struggle from every day, and sometimes you just need to work with him and have patience. So I think maybe that will help a little bit when dealing with his disorder.
Based on our own research, schizophrenia tends to run in families through a gene. It happens to be a combination of genes that cause the illness. The structure of the brain is different with people who suffer from schizophrenia, an imbalance of neurotransmitters. This is why a catalyst of a neurotransmitters is the treatment of the illness.
All right, Jim. Have you been having any like issues performing any like daily tasks that normally you would not need like help with?
Yeah, my parents get really frustrated with me because they think my room is messy, and I guess it kind of is, but I just like to be in there. I also, if they don't make dinner for me, then like I don't really know what I'm supposed to do, like to make dinner, or like I don't really know how.
Right.
So it's kind of like I just need them for a lot of things, but I'm trying to not do that. I want to get out on my own and get a job, but it's really hard to keep a job too. It's just, I don't know.
Yeah, I understand that. Well, most people like with schizophrenia and with what you deal with every day are completely 100% unable to work, complete school, and must live on like disability payments. Like I know you had brought up earlier that that you were enrolled in college when you first started having these symptoms. A lot of these individuals cannot live a normal lifestyle. This is due to the effects that the illness or sometimes the medications have on you. Sometimes this could be due to the flare-ups of your schizophrenia. This could be due to anxiety going on, stress in your life, and this can cause your schizophrenic symptoms to come back, such as your delusions or your hallucinations. You are unable to work and everything. I know I brought up like the disability payments and everything. Have you ever thought about going on disability or just trying to get help in general with dealing with daily tasks like besides your parents?
Yeah, I haven't done that.
I know sometimes like you definitely brought up that you wanted to be independent. Maybe once we get you stabilized and on your medicine and on your new medicine, we could get you into a possible like volunteer position to try to help you maintain your normal life back to what you would really like it to be. Do you think that would be good? Something to think about?
What medicine do you want to put me on?
I've been thinking about putting you on risperidone. This is different from Thorazine in a little bit of a different way. Risperidone is known as a second generation antipsychotic. It's known to decrease your symptoms, your positive symptoms, which would be your hallucinations, your delusions, anything that's really going on in your life. However, there are some more side effects with the one you are on now, as we talked about earlier with the TD and everything. This one would not make you feel as tired or dizzy, which I'm sure you would like. The big thing that helps with the risperidone is changing your environment as well. You can't, taking drugs, so you wouldn't be smoking your marijuana anymore, or consuming your alcohol. And I know that could cause some of your